Hello, my name is Снежанна Борцова, and the topic of my research is the diagnostic concept of schizophrenia, its history, evolution, and future prospects. The reason I selected this topic was my career choice. I've always wanted to link myself with a profession in psychology or psychiatry, as I have a strong interest in health knowledge. In the end, I decided in favor of psychology due to my apprehension of dealing with severe cases and conditions. However, hard cases are inevitable in psychological practice either. Certain psychiatric disorders present too big a challenge for specialists. At the same time, they are the most interesting ones in theory. My research is an attempt to get an insight into one of the most difficult diagnoses, namely schizophrenia, in order to come to a well-balanced judgment about the disease. My work includes 3 chapters that regard schizophrenia and its complexity. People often have erroneous understandings of the disease itself, as scientists do not have enough results concerning this issue, and the available data are sometimes contradictory. The lack of information is the reason for the stigma surrounding schizophrenia. It is assumed that schizophrenia has multiple causes. Some consider it to be hereditary. A striking example is the family of Galvins, who have helped advance the study of the disease with 6 schizophrenia patients out of 12 children overall. The studies conducted on the family led to a conclusion about the real cause of schizophrenia as a compilation of heritability and environmental factors. This theory was named diathesis stress theory, and its principle is nurture activated by nature. The term schizophrenia was coined in 1911 by Swiss psychiatrist Eugene Bleuler. It derives from 2 Greek roots, schizo meaning split and phrene meaning mind. The term meant to underscore the mental disarray and fragmented thinking experienced by individuals with the condition. Regrettably, the misconception of schizophrenia as a disorder involving split or multiple personalities has persisted to the present day. Until 2013, schizophrenia was officially recognized as having 5 distinct subtypes: paranoid, disorganized, catatonic, residual, and undifferentiated schizophrenia. These subtypes are still used by some healthcare professionals as they illustrate the diversity of conditions. In 2013, the classification was reconsidered, and now schizophrenia is understood as a chronic mental health disorder existing on a spectrum of psychotic illnesses, such as schizoaffective, delusional, brief psychotic, schizophreniform, and schizotypal personality disorders. Altogether, schizophrenia affects an individual's perception of reality and can lead to emotional challenges, impaired rational thinking, and difficulties in relationships with other people. Since the past centuries, the treatment methods for schizophrenia have drastically changed. No more insulin shock therapy, trepanation, and other physical tortures. Nevertheless, we all know there is still a lot of room for improvement. Modern treatment for schizophrenia relies on antipsychotic medication that block excessive dopamine activity in brain cells, thus diminishing schizophrenia symptoms. In the 1990s, a hypothesis appeared of beneficial effects nicotine has on schizophrenia patients. The alpha-7 receptor has a special connection with nicotine. Nicotine enhances the effect of acetylcholine, which is a neurotransmitter that is necessary for this receptor's functioning. Scientists have developed nicotine substitutes working on patients as cigarettes on smokers. They have the same sedative effect but last longer, for hours or even days. Another approach is the genetic one. Some doctors work through the mission to repair the flaws in their respective gene. Such interference can only be conducted at the prenatal developmental stage of those genetically predisposed to schizophrenia. This procedure would imply numerous formal and legal issues which make the goal almost unachievable. Not on genetic level, scientists have found probable solution, namely non-toxic, benign, and available nutrient choline, which was experimentally shown to reduce social withdrawal and attentional problems. In 2017, choline supplements were approved along with higher doses of choline in prenatal vitamins in order to prevent schizophrenia and other brain development disorders. Over the past decades, science has changed its methods. Even considering that there is no medicine for schizophrenia, today we can normally deal with ways of prevention and decreasing the symptoms. A person who experiences symptoms of schizophrenia should be urgently addressed to a psychiatrist. The group of specialists would provide prevention if the patient is at an early stage of developing the disease, or the treatment to decrease the symptoms. This is the bibliography of the paper, but instead of dealing with this complicated slide, you can use this QR code and read the full list of my sources. And also, I'd like to underline one book named Hidden Valley Road. This book is about the family of Galvez, which I mentioned, and it would be fascinating even for those who are not interested in medicine at all. And thank you for your attention. Please take care of yourself.
I think it is really important to dispel such rumors about such devastating diseases as schizophrenia. So I have a question for you. How to convince a schizophrenia patient to ask a specialist for help? Thank you.
It is complicated because I would provide an imaginary example. If you have a close friend or family member with schizophrenia, I think you should ask a specialist for help, because doctors can medicamentally force schizophrenia, any patient, medicamentally force a patient only if they're in jail. In any other situation, it is unachievable, and doctors cannot force the patients. The patient is at a severe developmental stage, but if the patient is at an early stage of development of the disease, I guess you should point to the flaws in patient's behavior, because different aspects of patient's behavior can make an impact on his life, his daily activities, and lives of their family, their beloved ones. So it has a huge impact on everybody.
How often is schizophrenia misdiagnosed, and what other disorders have similar symptoms? Thank you.
I think, I guess schizophrenia can be misunderstood as a bipolar disorder, I think. And also I'd like to mention that in this classification we have schizoaffective disorder, which has symptoms of both schizophrenia and bipolar disorder.
What are the future prospects for schizophrenia treatment?
I think the future for different brain development disorders, not only for schizophrenia, is in genetic engineering. I think, actually, I love your question, and I think genetic engineering is, this is the science of the future, because actually we have enough knowledge in this field, but we cannot use these ideas because of some ethical norms, because of Vienna Convention, and I think we should provide more experiments to show that we can use this science.
Can some medications that doctors use to treat schizophrenia be somehow harmful for patients' health?
Yes. They virtually can. Actually, antipsychotic medications I mentioned can be harmful for the patients, because there's a quite paradox about them. They decrease common schizophrenia symptoms such as hallucinations and delusions, as I mentioned, but they increase patients' need to socially isolate themselves. And it can cause depression, and simply saying, the more such medicine you take, the more depressive you become, if simply saying. Statistics say that half of schizophrenia patients attempt suicide, and actually suicide attempts are more common with patients with more remissions, periods of remission.
My question is, in society, schizophrenia is often really looked down upon, especially like patients with schizophrenia. And I was just wondering, what are some possible methods for destigmatizing the disorder and for making people stop looking down at people with schizophrenia?
I think people should more openly talk about such severe disorders such as schizophrenia to break the stigma, because a lot of stereotypes have their impact on patients. I just trying to say that we need to talk about such diagnoses, such disorders more, because people should be aware of the symptoms, should not ignore the signs.
Is there a disorder that was purely considered as a type of schizophrenia? Thank you.
Schizophrenia firstly was misunderstood as a form of dementia I think in the 19th century, but then couple of decades later, it was understood as a schizophrenia, and as I said, the term was coined in early 20th century.
What is the novelty of your academic writing?
In my work, there are some conclusions in the most debatable questions about schizophrenia.